Hello, I'm Dr. Beach, and today I want to talk about the topic that I hear a question a lot. I hear from patients, which is why does my back pain keep coming back? And pain is actually a way that our body's telling us that something's wrong. It's always one of the ways that our body talks to us. It talks to us in many fashions, but that's one of them. That's a negative uh, message that we get from the body. And pain is always coming because of some inflammation that's there. Inflammation creates, in the musculoskeletal system, inflammation will create some usually muscle spasm, which decreases the oxygen flow through the muscle. And then that in turn creates more pain, which then creates more inflammation. So it's called the pain spasm cycle that occurs. So if a person's having pain that keeps coming back, in this case the question was, why does my low back pain keep coming? Then it means, in my mind as a practitioner, it means that I'm missing perhaps what the etiological factor is. What is the basic reason this person's getting pain? For those of you who have gone to chiropractors before, you may have had the experience that you go and you get adjusted, you feel better, and then a little while later it keeps coming back, so you just keep going back again and again. And many of my patients come back again and again too. But if it's possible to find what the underlying causes of the pain, then we try to do that. And we'll be making some other videos on what some of those causes may be. But if the pain is just, if you get adjusted and a few days later it comes back and you keep doing that back and forth, then it means that somehow or another we're not really finding the cause, and we need to look more deeply for that. Sometimes the cause can be something as chronic and debilitating as arthritis. And in that case, there's nothing we can generally do about the cause itself. However, there are ways in Ayurveda to create more alkalinity and less inflammation in the system, which will help the arthritic pain a lot. But in terms of doing something to that arthritic joint from a chiropractic point of view, we can move it, we can adjust it, that will make it feel better, but the arthritis is still going to be there, so it will have a tendency to come back. But if the cause is, so say for instance, a postural problem, maybe the person has one leg shorter than the other and it's creating some imbalance in the pelvis, and then they're having to lean back to compensate for that, that's something we can fix. So we can look for that. If it's weakness in the muscles, maybe in the core, that's allowing the back to sway too much. Sway back is the number 2 cause of low back pain. And so maybe the person has too much sway back because the stomach isn't strong enough. That's something that can be fixed. Maybe it's a disc problem. Sometimes the discs will swell and push on the delicate nerve structures and cause back pain. That's something that can be fixed chiropractically if the disc hasn't ruptured. But if it's ruptured and it's completely desiccated and the material that's on the inside of the disc has leaked out, then typically only surgery will help that. So the answer to that question is a little complex depending on the person, but it does tend to come down to what is the real cause of the pain and how to treat the real cause. What we tend to do in our culture today is just treat the pain itself. That's why prophylactically anti-inflammatory medication like Advil and Tylenol and aspirin and all that is such a big business today because it stops pain. But rarely does that actually stop the reason that the pain is there. And so that's what we look for in chiropractic. That's one thing I think is unique about what we do, is try to find what that etiological factor is. Thank you.